All right, welcome back. If you missed the very beginning, I just wanted to remind everyone that each session is separate. So you will need to leave one to go to the next session. We did this so people could easily go back and review an individual topic than having one 4-hour block. So I know that's a little confusing. We can put that back in chat again to remind everyone. Another reminder is to please post your questions in the chat on the Passable platform. We're going to address as many as we can. We're also saving the chat, so all of your questions will be answered. We also have 3 subject matter experts who will review your questions throughout the sessions and provide answers. Donna Wanucha and Katie Kennedy are both retail food specialists with the Office of State Cooperative Programs, and Mary Beth Neeson is with the Office of Partnerships. So please look for their response with your question, and they are ready. All right, so let's get started on our next session. This is how to create a project implementation plan. I know that there was a question on the difference between this and what the first session was, so that will be discussed today. It's my pleasure to introduce both of our presenters for this session, Carolyn White and David Engelskirchen, both retail food specialists at the Office of Cooperative Programs. So I'll hand it over to you, Carolyn.
Great, thank you so much. All right, and for confirmation, you can see my screen share, correct?
Correct.
Wonderful. Okay, so good afternoon, everyone. In the previous presentation, Catherine and Becky went through the process of creating a comprehensive strategic improvement plan, or CSIP. In this session, we are going to discuss how to create a project implementation plan, or PIP, for your retail flexible funding model application. So as Tracinda had mentioned, just as in the earlier presentation, we ask that if anyone has questions during the presentation, please feel free to put them in the Passable chat. We do have subject matter experts standing by that will be monitoring the chat. At the end of the presentation, we do have a short Q&A portion where we'll go over the questions posted. There's also an FAQ portion of the presentation that may answer some of your questions. So with that said, let's go ahead and get started. So our objectives for our presentation today is we're going to review the differences between the CSIP and the PIP. We're going to examine the requirements for the PIP under the retail flexible funding model. We're going to identify the basic elements of what's in a PIP, and then we're going to evaluate some actual examples of written PIP scenario templates. So I've heard many folks asking, what exactly is a written project implementation plan? Essentially, a PIP is the project outline for how you're using the grant funding. A written PIP is a required part of a retail food program's application for funding covered by the retail flexible funding model. And the project implementation plan needs to include a few things. First, a detailed plan of work for achieving the project outcome or objective. Essentially, this is what you plan to do, when you plan to do it, and who is going to be responsible for ensuring the project is completed. The PIP also calls for a budget justification for each activity. So this is a newer requirement. While compared to previous retail funding opportunities with award amounts that are based on flat rates, the retail flexible funding model awards are based on actual estimated project costs. You get to tell us how much it's going to cost to do the things you want to do. And finally, a PIP must also include specific time frames, identify key personnel, and list other resources necessary to achieve continuous measurable improvement relating to the funding project. So all retail flexible funding model applications must have a project implementation plan that fully explains the funding request and outlines the details of how the jurisdiction will use the funding to accomplish their goals. While many funding projects will be pulled straight from a jurisdiction's comprehensive strategic improvement plan, not every funding project will be specified in your CSIP. In fact, for applicants that are new to the standards, they may not even have a CSIP in place. And so you could be applying for funds to develop your comprehensive strategic improvement plan. So you'll still need a PIP to justify those project costs. An additional example is, for example, if a jurisdiction is sending someone to a training or a conference, those items may not specifically be listed in your CSIP, but will still need a PIP. So regardless of the proposed activities, FDA needs to have the information from the applicant that outlines the details of who's going, what they're doing, who's responsible, how much it's going to cost, how much time is going to be spent, and what resources are going to be needed. The PIP explains these specifics. So we want to take a look back at some lessons learned from a local jurisdiction who was recently working on a project related to Standard 9 to complete their foodborne illness risk factor study. So this jurisdiction, a city health department in a large metropolitan area, spent the better part of 2021 completing their foodborne illness risk factor study. And their project lead determined recently that they missed some key steps along the way, which resulted in a significant amount of questions about the process. It created extra work and it led to project delays. This caused confusion and frustration for many project team members. And so the project lead realized they lacked a project plan that could help alleviate many of their problems. And so they decided to develop a general timeline to lay out the steps to efficiently finish completing their work on their study. And the plan broke down each activity by phase, and each phase had specific action steps and key outcomes listed. And the phases also identified necessary staff involved, such as interns, the grant planning team, and qualified contributors. What this jurisdiction put together is essentially a project implementation plan for the risk factor study. Now, they did it after already being midway through their project, but they still ended up with a project plan that they can then use moving forward with subsequent studies. And they took lessons learned from initially kind of stumbling and faltering through the process without a clearly defined plan and improved upon it so they would not repeat the same mistakes in the future. So real quick, let's review how the retail program standards, your written CSIP, and a written PIP all tie in together. Remember, the retail program standards are intended to provide goals and criteria that are part of a retail food program's continuous improvement process. The regulatory retail food program's written CSIP is that roadmap that guides the future direction of the program towards meeting the requirements of the standards. And PIPs are intended to focus on a specific project or initiative for which funding is requested in order to support the achievement of a program objective or outcome. So I saw this question come up in the previous session, and so let's talk about it. There are several similarities between the CSIP and the PIP. For example, we have to specify action steps, we have to name responsible individuals, and we have to list timeframes. But the two documents serve very different purposes. So let's talk about some of the key differences between the two. First, let's talk about the CSIP. A written CSIP is based on the results of a completed self-assessment of all 9 retail program standards and documents measurable continuous improvement with the standards. Essentially, the CSIP is that long-term, multi-year project plan that guides the work of the regulatory retail food program towards meeting requirements of individual standards not met. And keep in mind, as we mentioned earlier, the CSIP should be a long-term planning document and should extend beyond the grant cycle. And the plan may also include tasks related to maintenance of standards already in full conformance and planning for future self-assessments. Now, let's see how the PIP differs. A written PIP is short, focused, and executable. It can be based on the CSIP and the results of a self-assessment, or it can be written for special projects and other priorities that will help the jurisdiction move towards conformance. Now, the activities in the PIP are specific to the grant funding period. So remember, while your CSIP is this long-term planning document, your PIP is going to be specific for the 1 or 3-year grant application you're putting forward. And while a PIP may provide similar information to the CSIP, it also asks the applicant to identify specific needs and resources, really drilling down on how they will execute the action items using the funding requested. So remember, a PIP is related to the funding project. The timelines in the PIP are specific to the grant funding period. The intent of the PIP is to inform FDA specifically how grant funds will be used to support the retail food program's goals and objectives. So let's talk about some key components. These are going to look really similar to the earlier presentation, but a PIP needs to address the what. What is the project goal and objective? We need to include a detailed plan of work for achieving the project objective or outcome. It should specify the improvements needed with action steps and tasks to address the standard element not met. We want to name the who. Who is the lead for this project? The PIP will identify personnel responsible for completion of the specific steps or tasks. When will you complete the project? Target completion dates for each action step and task should be identified. And finally, we want to address the how. How will you plan to accomplish this project? List out all resources needed to accomplish each action step and task, including that detailed budget plan, the staffing requirement, and the equipment. So for a quick example, a jurisdiction that's in the development phase or track 1, track 2, applies for training funds to attend the self-assessment and verification audit workshop in order to complete their self-assessment. You'll need to have a PIP for that. A jurisdiction in that maintenance and advancement phase or track 3 may want to use funds for some larger scale projects. The PIP outlines the funding request, but these activities may not necessarily be directly tied to meeting a specific standard and may not necessarily be listed in the CSIP. So really quickly, if you'll move over to the poll section tab in the Pathable chat, we're going to go over some poll questions. These are all true, false, so only one answer will be needed. And I'm going to see if Daphne can put all 3 polls in at one time. So it's a quick review. I know y'all didn't think we'd be testing you so early, but let's just take a look, shall we? So the first question is, are CSIPs are they long-term and can extend past the grant cycle? True or false? The second question is on the PIPs. It says PIPs are short-term project-based plans. Is this true or false? And for our third question, the CSIP explains the funding request. True or false? And so we'll give folks some time to answer the polls and then we'll see how you did. All right, let's check on that first question. CSIPs are long-term and can extend past the grant cycle. That is true. For question number 2, PIPs are short-term project-based plans. That is also true. And then our third question, the CSIP explains the funding request. True or false? Did we get anybody there? The answer is false. It is the PIP that explains the request for funding and includes that detailed budget information about the project for which funds are being requested. So if you're just getting started in your work with the retail program standards, or maybe you're enrolled and have been inactive or getting going again, or maybe these 2 workshops have gotten you thinking, I should enroll in the retail program standards, and you're ready to take that leap. Let's take a look at some activities that would require a PIP to be eligible for funding under the retail flexible funding model. So the PIP can be used by a retail food program to lay out specific action steps for completing the following projects. You could use it to conduct your first full self-assessment of all 9 retail program standards. You could, you need a PIP to develop your written CSIP. And you can use a PIP to lay out specific action steps for verification audits of standards that a jurisdiction reports as having met. If you're already enrolled in the standards and you're making some movement and you want to continue to make some progress, or you're wanting to really take the leap and do some like heavy work, you'll need to outline your activities in your retail flexible funding model application. Let's talk about some ways you can use a PIP to outline certain projects that will help with achieving that continuous progress with the retail program standards. And remember, the PIP can address specific elements in the jurisdiction's written CSIP that are not in conformance with retail program standards criteria. So some example projects may include initiating and executing the jurisdiction's process for updating their food code, developing foodborne illness surveillance and response protocols, like looking at standard 5. You could use it to conduct data collections as part of that risk factor study. You'll notice we keep talking risk factor studies in standard 9, where we're really wanting jurisdictions to really start focusing on those things. And you could use the PIP to develop and implement intervention strategies designed to reduce the occurrence of foodborne illness risk factors. So the options are really endless. You just need to find what's going to work and then create a PIP to make that happen. And for those jurisdictions who are wanting to take on that optional add-on funding opportunity in order to advance their retail food program, you can use a PIP to outline projects to move your retail food program forward as you work towards maintaining conformance with the retail program standards. So the retail flexible funding model provides optional add-on funding opportunities that require submission of a PIP. These activities were discussed earlier this week in the retail flexible funding model presentation that Mary Beth gave during the general session, and we'll do a brief recap. So these include participating as a mentor or mentee in the program standards mentorship program. You could use the add-on for training and staff development and program standards engagement to send staff to training, such as attending the retail food program self-assessment and verification audit workshops. participating in retail food courses and we can finally be in a classroom back together again, or when we get to do our retail food seminars in person again. You could use the option for capacity building, which is those large-scale collaborative projects with other regulatory jurisdictions or partnering with academia and industry or associations. When we think of some examples of those projects, it could include the development of uniform inspection procedures or protocols for a region, or cross-training events with multiple jurisdictions to further conformance with the standards. Again, thinking standard 5, could we do a large regional outbreak? We could do anything. And finally, that special projects optional add-on is designed for projects that are outside of the scope of the standards and address something big picture. Developing that new electronics risk-based inspection system you've been dreaming about. There's funds available to look at those, or looking at developing IT systems to collaborate with FDA or other agencies. All of these require a PIP. So moving into what this actually looks like. Here we have a blank example of a written PIP template. So this template is just an example of how a jurisdiction can construct their plans and what to include. Remember, this is only intended to serve as a resource tool that jurisdictions can use. There's no one right way to develop the PIP. If you already have a template that you're using for your CSIP, you can adapt that for your PIP as well. Jurisdictions can use whatever format and templates to construct their PIPs that best meets their needs. So with the PIP templates that we provided, there are 2 options for tracking start and completion dates for activities. Option A, which we're discussing on this slide, includes a Gantt chart that spans multiple years with each year broken down by quarter. Tracking activities with this option can be helpful for multiple projects that span up to 3 years, such as the Track 3 base box or that capacity building add-on that we talked about earlier. Let's take a look at what option B is. So here we have option B, which includes start and completion date columns in month, day, year format. So whereas option A was broken down by quarters in the 3-year period, option B provides start and completion dates and may be a better fit for projects that are to be completed within 1 year, such as our Track 1 or Track 2 base funding options. So let's look in and take a deeper dive into the top part of our template and briefly go over what each of these things really mean. So the jurisdiction, that's going to be the name of the regulatory retail food protection program. Your project lead will be the name of your jurisdiction's project manager responsible for oversight of the written PIP. Your project support team should include names of both your internal staff members and external support contacts that are responsible for the completion of action steps and tasks within the PIP. Your project description will be a brief description of the project goals and objectives. And that project period will be that start date for the project to completion date, remembering that depending on which grant we're applying for, will really be either that 1 or 3-year cycle. Our current project status should be that brief description as to whether the project is on track or whether it needs to be adjusted. So next, let's discuss the next boxes, which are our action steps and tasks, individual lead, and let's dig into what that actually means. So our action steps or tasks, this is where you're going to enter the description of the action step or task needed to achieve the project objectives and milestones. There are likely to be multiple action steps or tasks needed to achieve the project deliverable. So let's enter one activity or task per line. And this could expand to have several lines. That's okay. Our individual lead is going to be the name of the program support team that is going to be responsible for that specific activity or task. You may have more than one individual lead working under the same area, just on different action steps or tasks. The resources area, this is the moneymaker, right? This is where we're talking about budget. This is where we're talking about the FTEs required to accomplish the goals, the equipment needed that you may have or you may need to purchase. Any other support needed to achieve the deliverable outcome or objective should go in this box. This is going to be your heavy hitter. And then your target completion date will be the jurisdiction's projected milestone date for completing that activity or task within the PIP. Remember, as previously discussed, there are 2 options for tracking start and completion dates for activities, and these are included with the example template, option A and option B. So this slide is a visual of option A, and we'll go over the remaining boxes. Year 1 through 3, it's the tracking portion of this template that allows proposed actions to be visually tracked by quarter in the form of a Gantt chart. I love Gantt charts. And your comments, The use of this field is optional, and it's included to provide the user to enter any additional information that might be relevant to the action step or task. So if you feel you need to put more things in, use this comment box. And the final element of the PIP template is to document how you measure progress with the proposed action steps or tasks. A color-coded legend is provided with each standards action plan as a method to visually track the status of each of the activities. The background for within the action steps or task column can be color-coded to reflect its status. So it's a lot of information, but now that we've walked through the basics of the PIP, I'm going to pass the baton to my colleague, David. David, go ahead and take it away and show us what some of this actually looks like.
Okay, Carolyn, thank you. Here we go. I'm going to share my screen real quick. Let's see. This is the hardest part of my presentation here. Okay, here we go. We're ready to go. So thank you, Carolyn, for that excellent introduction to the project implementation plan. And what I'm going to do here is I'm going to walk you through some examples of a project implementation plan. So what you might recall is before we started the workshop, we had posted up on the workshop page an example of a written project implementation plan template. For this activity, I'm actually going to walk through those same templates that you have. And if you haven't downloaded them, you can always get them on our website or on the NEHA's website as well. They are provided later on. But the key is if you want to follow along, please do. If not, you can always refer to them later on. So we're going to be looking, can you all see the PowerPoint? I'm getting messages saying that maybe you can't see it.
No, David, we can't.
Shoot. Sorry about that. Here we go. We're going to start over. I told you this was the hardest part. Okay, hopefully you can see it now.
There it is, David. All good.
Okay, thank you, Tricinda. I'm not seeing it right though. This is not. How about now? It should work. Everybody sees it, right? All right,
Yep,
here
perfect.
we go. Thank you again, Carolyn, for that excellent introduction. Let me close my Teams. I'm getting messages about what I'm doing wrong here. Now let's walk through an example of this scenario using the project implementation plan template. I think I've already said this, but you should already have a copy of the template available to you. Hopefully you've got it in advance of the workshop, or you pulled it down from the platform when you logged on this morning. Anyhow, we're going to be looking at examples for both the maintenance and advancement based funding and the development based funding. Some things to consider before we look at these examples. These are intended to serve only as an example, and jurisdictions should develop action steps for their project implementation plan that meet their specific program needs and available resources. The timeframes in the examples are specific to the hypothetical jurisdictions of these examples. And whether you are representing a one-person program or a jurisdiction with a large planning team, it is important to establish a project timeline that is specific to your unique situation. If you have questions or need technical assistance with developing your project implementation plan, reach out to your FDA retail food specialist as a resource. For the first example scenario, here's some background information on Cactus County to help give context. Cactus County's retail food protection program has a 6-year comprehensive strategic improvement plan that has mapped out their action steps on individual standards to gain conformance across the board. For this project period, Cactus County is applying for funds through the maintenance and advancement base box to complete the following specific activities over the next 3-year grant cycle. They want to conduct a risk factor study, including implementation of intervention strategies in restaurants, retail food stores, and healthcare and school facilities. They want to develop procedures and policies to achieve conformance with Standard 3. They also want to maintain conformance with Standard 7, which they have already met and had verified. They will develop and implement a compliance and enforcement policy for Standard 6, and they will develop agency infrastructure to complete standardization of retail food inspection staff for Standard 2. So you may recall the scenario from the previous Comprehensive Strategic Improvement Plan workshop that Cactus County had already met a few of the elements of Standard 3, but still had some activities to accomplish before coming into full conformance with the standard. For their project implementation plan, they have mapped out the specific action steps remaining to meet Standard 3. Now they are requesting funding to finish work on this standard and have outlined their remaining activities on their project implementation plan. The specific action steps and tasks they have outlined are centered around developing procedures and policies to achieve conformance with Standard 3. They are planning to draft policies that require on-site corrective action for foodborne illness risk factors that are observed to be out of compliance, and draft policies for variance requests and the verification and validation of HACCP plans. Once they have the policies drafted, they have also listed out action steps to conduct staff reviews and training for each policy, and then finalize and implement the developed policies. As you may be able to relate, developing policies, training staff, and implementing those policies can take some time. Cactus County has planned to do some of their activities in year 2 of their grant to account for the availability of resources and staffing. Remember, the Option A example project implementation plan template includes a Gantt chart that breaks down activities by quarter over multiple years. Cactus County used this version of the template for outlining the details of their project implementation plan because they are applying for a 3-year maintenance and advancement funding, and their projects span over multiple years. Tracking activities with Option A can be helpful for multiple projects that span up to the duration of a 3-year grant cycle for maintenance and advancement. Cactus County is also requesting funds to conduct a risk factor study, including implementation of intervention strategies in restaurants, retail food stores, and healthcare and school facilities. They have listed out specific action steps for those activities. Their project implementation plan for the restaurant facilities portion of their risk factor study includes action steps to prepare and complete data collections for the first data collection period, starting in June of 2022, then completing a report summarizing the key findings from their first data collection period in September of 2022. After that, they will develop and implement a risk factor intervention strategy based on key findings from their first data collection period from June of 2023 through 2024. And they will then they will prepare for the second restaurant data collection to be completed in 2025. You will now notice how the project implementation plan is useful for planning and tracking the activities over time so that Cactus County can ensure they have adequate resources along the way and are not overextending themselves at any given time. Cactus County has also prepared a budget summary sheet to submit with their funding application. Again, they are applying for funds in the maintenance and advancement base box for a 3-year funding period from 2022 to 2024. This summary sheet contains specific details that tie the resources column tied to the resources column of the project implementation plan. Cactus County found that preparing a budget summary sheet was a helpful way to outline their estimated cost associated with each action step listed in their project implementation plan. They also anticipated this would help them when entering their budget request information into the grant portal. For the second example scenario, here is some background information to help give context. Bear River County Health Department is in a much different position than Cactus County. They have just enrolled in the retail program standards, and after discussing their program priorities with their retail food specialists, they have decided to apply for development-based fundings to complete the following activities. They want to complete a self-assessment of all nine retail program standards, and they want to attend the self-assessment verification audit workshop. They have decided, based on their available staffing and resources, that they may want to apply next year for development-based fundings to complete a comprehensive strategic improvement plan or receive mentorship from a more experienced jurisdiction. But for now, they simply want to focus on completing an initial self-assessment of all 9 standards. In this example project implementation plan, As a newly enrolled jurisdiction, Bear River County is requesting funds to attend the face-to-face FDA self-assessment verification audit workshop. They have outlined action steps and tasks specific to this project, which include completing workshop registration, making travel reservations, completing a prerequisite review of the criteria contained in each of the 9 retail program standards, and attending the face-to-face workshop. Their program manager, Sally Willow, is listed as the individual lead for all of these activities. You may notice that in the resources column, there are some hypothetical cost estimates based on one person, the estimated time for each activity. You will want to fill this out in your own project implementation plan specific to your anticipated cost. Details to be outlined in the resources column include budget, full-time equivalents, equipment, and other support needed to achieve the deliverable outcome and objective. For example, resources requested to attend a self-assessment and verification audit workshop may include travel costs, such as flight, lodging, and ground transportation, registration fees, and personnel time. Bear River County has discussed with their retail food specialists some strategies to help them get started with completing the initial self-assessment of all 9 standards. In order to make the progress most successful, here we see that Bear River County has listed out specific pre-steps that they're planning to complete prior to starting their self-assessment of all 9 standards. These action steps and tasks include forming a project management team who will complete the self-assessment of all 9 standards, reviewing the retail food program standards definitions, administrative procedures, and clearinghouse interpretations. The project lead assigning team members to specific standards and review and assess to review and assess, with the final review and oversight provided by the project lead. And as already outlined in the previous slide, the program manager is planning to attend the self-assessment and verification audit workshop. And they are not requesting funds for this activity twice, but they have listed it here simply for the purpose of tracking their preparation process for the self-assessment of all 9 standards. They have listed out target completion dates for each activity and will fill in the actual start date and completion date as they go along. There is also an optional field for comments that are relevant to the action step. Please keep in mind that these pre-steps that Bear River is planning to conduct prior to completing their full self-assessment are not required. They are outlined here to show some optional strategies that can be considered for a newly enrolled jurisdiction that is getting started with the retail program standards. As always, it's recommended that you work closely with your retail specialist for guidance. Once Bear County has completed their pre-steps, then they will be better equipped to dive in and begin their review of each standard. On their project implementation plan, Bear River County has further outlined the specific action steps and tasks they will complete to review each standard. For example, Bear River County has outlined their process to review each standard from January 2022 through October 2022. They have assigned individual leads to complete the self-assessment for each standard. They have identified that once all of the standards have been reviewed, the project lead will complete the FDA National Register Report, FDA Form 3958, to document the jurisdiction's completion of a self-assessment of all 9 standards, and then submit it to their FDA retail food specialist. In this example, Bear River County has put estimated personnel costs into the resources column for the time it will take their project management team to complete these action steps. When completing your own project implementation plan, you will want to estimate based on the details of your specific situation. Details you'll want to include in the resources column are anticipated costs, full-time equivalents, equipment and resource needs, or other support needed to achieve the deliverable outcome or objective. You may choose to add a budget summary sheet to more easily capture these details. On the NEHA Flexible Funding Grant website, you'll find, among others, you'll find these particular things that will help you in creating your strategic plan and your project implementation plan. There's also a document on the NEHA website titled Guides to State, Local, and Tribal Territorial Jurisdictions and How to Create a Strategic Improvement Plan. Also, if you're not familiar with it, you should go to the Retail Program Standards webpage, and what you'll find there is the actual self-assessment and verification audit gap tool, which has been widely used and is now available on the website for anyone who needs to use it. There's also a retail food specialist directory on that same web page, or you can just link to it here. And the most important thing is here you can go and find out who your specialist might be if you don't know that person. But that specialist can provide you examples, both simple and detailed examples of both the strategic improvement plan and the project implementation plan. And they can also provide a copy or access to the retail flexible funding model plan generator, which you'll hear about later on today in the last presentation of the workshop given by Alicia Johnson. And then last but not least, this was talked about during the strategic plan workshop. You should be familiar with the Food Shield Program Standards Resource Center. This is a place where cross-jurisdictional information sharing is happening all the time between jurisdictions that have been active in the program standards, and they share information with others. They'll share their successes, what's worked for them, and it's really a good resource for anybody who's involved in the program standards. So there's a couple poll questions, and unfortunately in this mode, I can't see the results, so I'm not really sure how we're going to do this, but I'll just ask you to go into poll and Pathable, and there are 2 questions there, and these are simple questions. We'll give you just a few seconds to respond. The first one is, have you already downloaded the Comprehensive Strategic Improvement Plan or Project Implementation Plans templates? And that's a yes or no. And the second poll question is, are you already signed up for Food Shield? And if you're not signed up, what I would recommend you do is reach out to your retail food specialist. If you don't have a Food Shield account, they'll guide you on how you can establish a Food Shield account. And then from there, you'll get access to the Program Standards Resource Center. But first step is check with your specialist if you don't have a Food Shield account, and they'll walk you through both processes. So we've got some frequently asked questions here that I'll discuss. And then obviously, as we've been going along, hopefully if you've had questions, you've entered them into the chat, and they should be answered either during the presentation today, or they'll be answered after the workshop by our specialists that are on the call. The first frequently asked question is, what is the difference between a comprehensive strategic improvement plan and a project implementation plan? We realize that the two contain some of the same information, but they do serve two completely different purposes. The written comprehensive strategic improvement plan is based on the results of a completed self-assessment and documents measurable, continuous improvement with the retail program standards. You should consider the CSIP a long-term, multi-year project plan that guides the work of your regulatory food program towards meeting the requirements of the standards that have not yet been met. Your comprehensive strategic improvement plan may also include tasks related to maintaining conformance with standards that are already met. On the other hand, the project implementation plan is a focused, short-term, and executable plan. It might be based on the CSIP and the results of the self-assessment, but it can also be written for special projects and other priorities that will help the jurisdiction move towards conformance. It asks the applicant to identify specific needs and resources, drilling down on how they will execute the action items using the funding. This second question, I think I saw this in the Pathable chat earlier, so I'll address it here as a frequently asked question. Do we need to submit a separate project implementation plan for each project? If applying for funds to complete a full self-assessment and all 9 standards and attend the self-assessment verification audit workshop, does that mean we need to submit 2 project implementation plans? And the answer is no. You can just list multiple projects on the same project implementation plan and enter that information in the project description box. To outline these separate projects, linking the years and various funded projects on one project implementation plan can be helpful to visualize the multiple funded projects and how their timelines intersect. So in summary, I'll just say that we provided today in our project implementation plan presentation the differences between the comprehensive strategic improvement plan and the project implementation plan. We've examined the requirements of a project implementation plan under the retail flexible funding model. We've identified the basic examples of a project implementation plan, and we've evaluated examples of a written project implementation plan using the scenario templates. Again, as in with the comprehensive strategic improvement plan presentation before this one, if you have any additional questions, please type them into the Pathable chat. Our subject matter experts on the line can assist with answering questions as they come in. And if we don't answer your question today, please do not worry. We're keeping track of all of these questions, and we'll be sending out a Q&A to all attendees shortly after the seminar. Thank you for your time today, and I'll pass it over to Tracinda.
Thank you, David. We did have a lot of questions in the chat, and I believe our subject matter experts are answering them. I'll open it up if anyone on our panelists would like to respond to any of the questions. I will mention that the link to finding your retail food specialist is on the bottom of every page of the Pathable page. So on the bottom of the workshop page or the home page, it is on the lower right-hand corner, and there's a link to find your specialist per your state. I think we do have the replies in chat. Just throwing it out there. Anyone wanted to comment? Otherwise, we can break early. Again, these are separate sessions, so you'll have to log off to this one and rejoin for the next session on submitting a grant application that Neha will be providing. All right, I think we're good. We will see you in 15 minutes at the top of the hour. Thank you.
All right, Sue.